The following is produced by 5 Star Productions USA, which is solely responsible for its editorial content.
There is no cure, and right now it affects 1 out of 100 people over 60.
Sometimes I have problems eating, getting the utensils to my mouth.
Parkinson's disease. Slowly, it can cause severe disabilities, but various treatment options can help control the symptoms.
When I got tested and found out that I had hepatitis, I was very confused.
Infectious diseases are among the top health concerns in the U.S., especially viral hepatitis.
Understanding can lead to prevention.
These topics coming up on Today's Health. This program is brought to you in part by the American Liver Foundation and by an educational grant from SmithKline Beecham.
Ponce de Leon was like many of us who are searching for our own version of the fountain of youth. While there's no way to stop the clock or to turn back time, there are many ways to live healthier and feel youthful, no matter how old you are. Hello, I'm Faith Daniels, and this is Today's Health. Unfortunately, we can't stay young forever, and some diseases, like Parkinson's, seem to affect more people as they become older.
The first time I noticed I have Parkinson's disease, I was driving on the highway holding the steering wheel, and my left side thumb started to shaking. I didn't pay too much attention to it, but later on I find out this is the beginning of the Parkinson's disease.
Parkinson's disease is one of the most common diseases in elderly, which affects the motor system. The patients become slower as far as their movement is concerned, and have tremor, difficulties in speaking, and difficulties to perform everyday activities.
Parkinson's disease, as we know it, is really not produced by trauma or stroke, accidents, or anything like that.
This disease is not curable, but is quite treatable. And if the patients are treated correctly, they do very well for a long period of time.
The first time when my doctor diagnosed I have Parkinson's disease, it was a minor thing to me because the same time happened I was operated with prostate cancer. It was a much more difficult thing than the Parkinson's disease.
Although there's no cure for Parkinson's disease, there are treatments that, when administered in the early stages, can help patients restore normal motor activity and maintain quality of life.
How's the mobility?
Mobility good. My doctor is very supportive. He's ready to do whatever need for the patient. He's taking his time. He's not just working for the money, he's working for the humanity of the disease.
Parkinson's disease should be treated early because lack of treatment will render the patient immobile.
Physical therapy is something that can definitely help patients with Parkinson's disease. It is not a cure, but it really can keep people more mobile, more able to do the things of life, and has been definitely shown to help.
It's not difficult to exercise. To golf is a pleasure to do. I like very much. And to bicycling also is not a hardship. I feel very lucky because even if it's 7 years old, my Parkinson's disease is not so much advanced stage than I expected. So I feel very happy about it.
The small motor skills of actually cutting your food or eating and feeding yourself was a problem.
Although we can't cure Parkinson's disease, we can control the symptoms with some success.
Parkinson's disease can be treated through either medications, physical therapy.
New advances are making it easier for patients to live productive lives. Coming up on Today's Health.
The Parkinson's disease isn't life-threatening. It does force serious changes in the lives of those afflicted. Fortunately, there's hope, and people do manage to be productive and comfortable despite their illness.
In 1995, I had a regular visit with my internal specialist, and he said that he suspected that I might have Parkinson's disease at that time because my arm was ratcheting when I moved.
There are times when I have problems getting dressed, and sometimes I have problems eating, getting the utensils to my mouth, getting in and out of a chair or the car.
There is not yet a cure for Parkinson's disease. We don't know the absolute cause or causes of Parkinson's, although we're making excellent progress in understanding many aspects of the disease process. We can, however, control the symptoms of Parkinson's today very well.
Parkinson's disease can be treated through either medications, physical therapy, and also surgical procedure.
I have a hard time with small motor skills like folding things and buttons, and I wear contacts, so to put contacts in sometimes was difficult.
The most difficult symptoms for me are when I'm slow. You just want to feel, and that's it.
For most people, the most effective medication in the treatment of Parkinson's disease is levodopa. This is converted to dopamine, the brain chemical that needs to be replaced.
As Parkinson's disease progresses, the medications that we administer for the disease need to be altered.
Some drugs, like levodopa, are very effective initially, but over time, Parkinson's disease patients will have to increase their dosage to maintain control of symptoms. Now, physicians can use newer dopamine agonists like Requip early in the disease to delay the use of these medications, which may be associated with disabling side effects after long-term use.
It interacts directly with the next cell, the receptor, the dopamine receptor on the next cell, and augments or restores the dopamine function. It has a long half-life in the body, so that unlike Cinemet, which over time begins to work for shorter periods, Requip and the other dopamine agonists, they last a long time in the body.
Well, I think that life is a blessing, but I also think that it's a blessing to me that I live at this time that I'm living in, because these drugs are now coming out that can actually do something with Parkinson's. And Requip has been the only new drug that's out in the last 8 years that can help people with Parkinson's.
He's basically back to his old self. There's not anything that he doesn't do. Like he says, he mows the lawn and helps around the house. And since we found out Bill has Parkinson's, of course, it's very upsetting. But I think he's cute still. I'm going to keep him.
Millions of Americans are affected by Parkinson's disease, not just physically, but emotionally as well. Let's meet one family and see how they handle the challenges presented by this disease.
I experienced Parkinson's about 15 years ago. My wife actually noticed my walking was changed. I felt a little betrayed. Why should it be me? Parkinson's, I'd always been careful of my health.
When I first heard that he had Parkinson's, I got real angry because I felt it wasn't fair to him, and then realizing, especially to me. I'm going to cut them smaller this time, Daddy, so they'll be easier to handle. Here's yours. The symptoms that I find most difficult to deal with is in the morning when he gets up. He has difficulty getting up and then putting both feet down and then standing up. We have used my crutches as an aid for him to get started. He doesn't use it that often. A major household alteration to accommodate Parkinson's. We remodeled the bathroom to be able to deal better with his advanced symptoms. Ed does a lot of normal activities around the house. He always has maintained our cars. He does all the maintenance in the house. He even helps me cook. And really, Parkinson's has not really slowed this man down from doing the things that he still enjoys doing and knows that he can still go on doing if he keeps trying.
3 years ago, I heard about the support group that met at Doctor's Hospital. I was very disappointed when I went there. There was just a handful of people.
They showed this tape of another group, how active they were. And so he got up and said, look at the contrast between this group and that group. And another member that was there, he was a caregiver, said, if you want to do something about it, I'll back you up. And that's how the group started.
And I can't help but think, what am I existing for? So far, there's no hope. There's only hope.
I think Ed's facing the disease the best way that he can, which is just keep on trucking. He won't lay down and die, and neither will I.
Not yet, anyway.
It can cause fatigue, nausea, and even yellowing of the skin.
I waited a couple weeks before I finally told my mom that I had it. I wasn't sure what hepatitis C was.
Viral hepatitis. It's an infectious disease that affects millions.
This disease often progresses to cirrhosis of the liver, which means scarring of the liver.
We'll explore this health concern next on Today's Health.
Viral hepatitis and hepatitis C are among the top emerging health risks in the United States. One of the problems with the disease is that 25% of the people infected don't even realize they have it. Knowing how hepatitis is contracted and what its early symptoms are can save lives.
Chronic viral hepatitis, a common infectious disease, is on the rise. And while perhaps not as familiar to us as AIDS, chronic viral hepatitis is a growing hazard to our nation's health.
More than 5 million individuals in the United States have chronic viral hepatitis. This disease often progresses to cirrhosis of the liver, which means scarring of the liver, and then can progress on to cancer of the liver.
Hepatitis A, B, and C are the most common forms of hepatitis. These diseases are very democratic. They affect men, women, and children of all races and all backgrounds throughout the United States.
Hepatitis A is the most common hepatitis virus that we diagnose in the United States. When it develops, it will last for 2 to 4 weeks, depending on how sick the individual is. It will present with a flu-like illness. Many of the hepatitis viruses present that way. And what alerts an individual to the fact that this is involving their liver is when they develop jaundice.
For the estimated 200,000 people infected with the hepatitis A virus each year, there is good news. Most will recover without serious or long-term health problems. Those infected with the hepatitis B virus, however, face a much more severe disease.
The number of patients who are infected with hepatitis B in the United States is thought to be approximately 1 million. Approximately 20 to 25% of these patients will probably die as a result of their chronic hepatitis B.
The patients who are asymptomatic with hepatitis B are usually discovered when they come in to donate blood, where they would be tested, or they may come for a routine examination to a physician.
The hepatitis A virus does not result in chronic infection, and most adults are able to fight off infection with the hepatitis B virus. This same scenario, however, does not hold true for people with hepatitis C.
In patients who contract hepatitis C, up to 85% of them develop a chronic infection with the virus. That translates into about 4 million people in the United States. Many patients with chronic hepatitis C don't have any symptoms at all, but when they do have symptoms, they can be mild or they can be fatigue, weakness, lack of energy.
Most new cases of hepatitis C occur in young adults aged 25 to 40 who may not learn that they are infected until years or sometimes decades later, after the complications have set in. Undiagnosed, they risk serious liver damage and may unknowingly infect others.
Hepatitis C is the leading indication for liver transplantations. Each year, approximately 10,000 patients die as a result of the complications related to chronic hepatitis C and cirrhosis. This number is expected to triple in the next decade.
It is extremely important that the American public has a better understanding about the seriousness of hepatitis. In fact, we believe that we need a wake-up call to alert people about how serious hepatitis is.
If you're on the internet already or thinking about it, you'll be amazed at how much information there is concerning your health and well-being. For a good start, visit our Today's Health website at www.dstar.com. Infectious diseases such as hepatitis can result in serious consequences if they're not detected early. Education, awareness, and intervention are essential in preventing any repercussions if this disease goes untreated.
Hepatitis A virus is transmitted by close person-to-person contact, primarily through fecal contamination. This is when people who are infected with the virus don't wash their hands carefully after using the bathroom. Examples of how that can lead to transmission to other people is food handlers or daycare workers or people living in very close contact with one another.
Well, I found out that I had hepatitis when I gave blood at school. Our school gives a blood drive every year, and I decided to give blood, and about 2 weeks later I got a letter in the mail saying that I had hepatitis C.
Hepatitis B virus is transmitted primarily via the sexual route. However, blood-to-blood contact can occur, such as when a healthcare worker has a needle stick accident from a patient who has hepatitis B virus.
I was first diagnosed with hepatitis B when my brother was diagnosed with liver cancer. When he was diagnosed, the doctors wanted all the family members to be tested, and it was determined that we were all carriers, probably born with it.
My parents were actually very surprised to hear that I had hepatitis C, and my mom had done quite a bit of reading about it, so she immediately took me to the doctor, and we had blood tests done. And they couldn't really fathom what was happening because they didn't see how I could be sick or how I could have contracted a disease like this.
The number one risk factor associated with transmission of hepatitis C virus is illegal injection drug use. However, hepatitis C virus can be transmitted via blood-to-blood contact, so that persons who received a blood transfusion before 1992 may be at increased risk for having acquired the virus. However, fortunately, since 1992, the blood supply is free of hepatitis C.
People who are from regions where chronic hepatitis B is widespread, such as Asia and the Pacific Islands, may be at increased risk of infection with the hepatitis B virus. African Americans and Hispanics may be at increased risk of infection with the hepatitis C virus.
If a person believes that he or she is at risk for hepatitis A, B, or C, it is very important to consult a physician because there is good testing for each of these three viruses.
Determining how to prevent and treat hepatitis is constantly challenging medical researchers. Each year they're finding new ways to battle this virus, which is extremely difficult to fight.
The American Liver Foundation and the American Digestive Health Foundation have joined forces so that together we could provide the American public with the information that they need to know about hepatitis. By working with the American Digestive Health Foundation, our viral hepatitis education campaign will be working with national organizations representing people at risk of hepatitis. And these national organizations are going to include national health organizations, human service organizations, as well as chapters of the American Liver Foundation. And together with the American Digestive Health Foundation, we will get these compelling messages out to people in America from all walks of life.
A lot of the Chinese people are very susceptible to it.
Sure.
It's very common.
So critical. We have to find good ways of communicating to African American community. We have to find. Clearly, hepatitis is everyone's concern. We are asking people to think about hepatitis and how it might specifically relate to them.
I think it's very important for people to know about the risk factors of hepatitis. I think by knowing how they can obtain the disease and knowing how the disease works, that they can prevent the spread of the disease.
Viral hepatitis exacts a tremendous toll on our youths. Hepatitis A is much more common in children than adults, and up to 90% of newborns infected with the hepatitis B virus develop chronic infection. Most new cases of hepatitis B are seen in sexually active young adults.
There are safe and effective vaccines for hepatitis A and B.
Unfortunately, there is no vaccine for hepatitis C virus at the present time. However, there is much research into the development of a safe and effective vaccine. If a person thinks that he or she is at risk for hepatitis C virus, it is important that he consults a physician for testing.
All people should consider being tested for hepatitis, especially people that might fall into high-risk groups. Like I said, I've never experienced any symptoms, and many people are carriers and never know it, and probably wouldn't know it until something drastic happened.
What's the secret to good health? Well, that's a question many of us ask ourselves, but it's really no secret. Good health requires the right amount of exercise, proper nutrition, and an overall positive attitude about life. If we can accomplish those three things, chances are we'll be a lot happier and a lot healthier. I'm Faith Daniels. If you want more information about anything we covered today, visit our website at www.vstar.com and join us again next time as we get right to the heart of matters concerning your life on Today's Health.
This has been a presentation of 5 Star Productions USA, which is solely responsible for its editorial content.